All right. Well, thank you so much, everybody, for joining in this morning on Saturday, January 17th, 2026. This is another one of our sessions, USMLE 101, that's going to be led by my colleague and friend here, Dr. James Ignas Koola, who has a passion for getting people into residency in the US. And we've been doing this for a couple of years now. There are some videos already on YouTube on this topic, but we always try to refresh it. There's new information that Dr. Ignas Koola is going to share with you with all the updates that are happening, and many of these updates are happening in real time. So please ask any questions you may have. The first hour is going to be sharing information, and the second hour hopefully will be a question and answer to address whatever questions or concerns that haven't been addressed through this talk. My name is Dr. Frank Minja. I'm a neuroradiologist based here at Emory University in Atlanta, Georgia, originally from Tanzania. And also I love to see all of you guys here, and I love you guys having the passion to improve your medical education. So without further ado, I'm going to invite Dr. James Ignas Koola to take it away. Karibu, Dr. James.
Hello, everybody. Welcome to USMLE One-on-One 2025-2026 season. It's my pleasure to be here and kind of take you through this program. As I said, my name is James Ignas Koola. My patient calls me Koola, so sometimes Dr. Koola works. Born and raised in Tanzania. I did my medical school in Muhimbili and then worked in Kenya for 2 years and then moved to the US to do my MPH at Hopkins. Worked in some research and then did my boards, and then I'm board certified in both internal medicine and preventive medicine, and I'm currently the associate program director for the internal medicine preventive medicine research program at Griffin Hospital, Derby, Connecticut. So I've been through it. I've been where you are several years ago, and it's really my passion, to kind of guide you guys and those people who decided to walk the walk and help you through. So this is the third year of these sessions, and what we are really trying to do is to reach the students very early, like in their MD1s. MD2s, so that they can kind of integrate into the system. And for the past 2 years, we are doing the sessions in November, and there was some issues in Tanzania around November. We couldn't do it, so we postponed it to January. And before this session, I was telling Dr. Minja, I think January is the best bet because people have come in, they have registered, they have started classes, the holiday have passed. And we think going forward, most likely we'll be doing it in January, whereby we can have more people come in and kind of, join the session. So before we started these sessions 3 years ago, it was to be like somebody who knows me or somebody who knows Dr. Minja or somebody who knows somebody who has done USMLE, kind of getting this information. And it was really getting hard when you deal with one-on-one because you spend so much time and they don't do much, like they are just exploring. It's one of their options. And so we wanted really to create a platform whereby we can reach the people we don't know. So the aim of this is to reach the unreachable. Like everybody has an equal opportunity. And we have tried to streamline. We have created a dedicated email that I'll share at the end. It's called usmle-specific@gmail.com. That's your primary communication site. So when you have questions, you have follow-ups, you are giving us update of what you have done, go through USMLE-specific. Now with internet and everything, it will take you less than 30 seconds to find my work email and email me. But don't do that. I know you can find it, but don't do it. Just go through USMLE-specific, whereby we can do it in a cohort form and kind of it help us be able to help as many people as possible. And in that way, kind of make this service reach many people. So it's don't try to tag, don't try to do whatever. Just follow through USMLE-specific and let this going. And as I said before, even if you listen to this live, you might be distracted here and there. At the end of the session, we'll send an AI summary of this meeting with all the action points. It's a very, very good digested summary. Take your time to read it. We will share the recording of this session, and all the important questions, we'll compile them and share them as well through your email. So take your time to go again through them, share with your friends, and kind of get it going. So I will kind of pull up my slides and go. As we go through the session, as those people who are coming in late, just add your country in front of your name. And by doing that, kind of it will help us know where you are coming from and kind of start building some kind of a community. If you have any burning question, before you forget it, just write it in the chat, and then the moderators I have, who I'm going to introduce shortly, will kind of be answering those questions as we go along. So don't forget about the questions. I mean, important thing. Probably the question you're thinking about, someone else is also thinking about the same question. So somebody is messing up my slide. I'll stop sharing and then start sharing again so that I can be on the clear. Good. So I have invited applicants, people who are now sitting for their exams, some residents, fellows, and attending who are going to be here with me today to kind of help and chip in. And this is really ABC one-on-one of USMLE. And what I tell people is just try to attend one session. Don't waste your bundle. Don't waste your time attending session year after year. It won't add anything new to you. Just take the information and start working on it. The key thing is that you prepare yourself and be ready to kind of tackle the exams and position yourself to compete for the graduate medical education slots. So our aim really by harnessing technology is to try to reach as many people as possible. And of course, we are trying. I couldn't get a panelist from Rwanda. I really tried hard. I hope you guys from Rwanda, if you know people who are in residence, who are doing exam, email us at USMLE-specific, connect us. We really love to have them be part and parcel of the process and to help people as they come through the application process. So the people I have with me today from Jamhuri ya watu wa Kenya, I have with me Grace Atieno. Here is Grace, born and raised in Nakuru, Kenya, went to Kenya High School, did her medical training in Maseno University in Western Kenya. She's now PGY1 doing pediatrics at the University of Indiana. Like 3 days ago, she told me she'll be on call. I'd made my slide already. I decided I'm not gonna change it. So Grace continues saving lives, but she'll be available. She's part of the USMLE team, and we really enjoy having her support going around. Below Grace is Nunex Mongare, who grew up in Laneti, Umoja, Nakuru, and went to Moi High School in Kabarak, and then is a product of the University of Nairobi. Nunex is now a neurology residence, PGY1 at Duke University in North Carolina. On the side here, I have Mohammed Omar, who is this year's applicant. So he's just done with his interviews. I was telling Mohammed, you need to certify your ranking order list. Just in case you go unconscious when you wake up, you have matched already. So you don't want to mess with it. So he's a 2023 graduate of University of Nairobi. And Omar did his USMLE Step 1 when he was in MD3. And that's phenomenal, And the way I met Omar is Omar was trying to network because now he's applying for residence. So I looked through and he emailed a friend of mine from Uganda, Joseph Lubega, who is a pediatric hematology oncologist in Houston, Baylor. And kind of, I'm Omar, I'm from Kenya, this is my CV, these are my scores, I'm trying to apply for residence, can you please help me and give me connection and things like that. And so when Lubega saw that, he texted me on WhatsApp and I met this young man from Kenya, he's very impressive and he's applying, can you help him? I say, I texted him, give him this email, usmlepursuit@gmail.com. And then after sending that, I had some downtime. So I looked at his CV And it's really important the way you communicate and like, wow, step one in third year, excellent scores, outstanding candidate. I don't want to miss on this. This is, I'll see the way I can see success on the paper. And I was like, I called him, we spoke, and we have continued to work on his application. And thank you, Omar, for being here. I'll be sending people your way, and I hope you're going to be there to kind of help them. Also from Kenya, I have Moza Abeid Hamoud. She confirmed with me yesterday that she will be here. So I had made the slides and I decided to put here. I met Moza in 2015 when she came to US after high school to start her college training in North Carolina. And so she finished the undergrad. She did her medical school at St. George's. She has been in the island, St. George. She has been with us from the first session, and she's very instrumental. She has been. She's a very good writer. Actually, I sent even Omar to Moza. Have your personal statement looked at. You know, when you write these things, you're applying. You really need to have mentorship all around. And this is what we are trying to do. So she's now PGY2 internal medicine at the Eisenhower Residence Program in California, and she wants to do hematology oncology as fellowship training. So here is me. I went to Moza graduation June of 2024, finishing her MD, and it's good to see people growing, thriving. And Moza, I'll come to your fellowship graduation. Residency, I'm not coming. So get your things together, and we look forward to do that. And this is my team from Tanzania. Starting from the left, I have Hezbon Magacha, who is PGY3 at East Tennessee University, and he went to Tabora High School in central Tanzania and then did his MD in Cuba. I met Magacha when he was doing his internship, and he has done his step one and is preparing for CK. So Magacha is an aspiring GI. He has been with us from session one. He matched into GI fellowship this year, and he wants to do endoscopic GI. So welcome, Magacha, and thank you for being here. We have in the middle Neema Machumu, who is now applying as well, like Omar, for residency in internal medicine. Went to Muhimbili and did MPH at Muhimbili, and now she's done with her USMLE, kind of putting her application together. On the rightmost is Robbie Alex Mwita, born and raised in Tanzania as well. Went to Kilakala High School in Dodoma. No, in Morogoro. Msalato is in Dodoma. And then she did her MD in Turkey. She learned about USMLE when she was in MD5. So when she was doing her internship, she did her step one. So she graduated in July, and she's getting ready to do her CK next month. So somehow, somewhere, Robbie found my phone number, kind of texted me on WhatsApp. I'm seeing this Turkish number, like I'm so and so, I'm doing this. And I was like, who is this? And the moment I got to know her and kind of see what she's doing, where she is, her dedication and everything, it was like, I've never seen such a dedicated young lady. And I was like, I need to be there. I need to guide her and support her. And she's doing great. Her family is in Shinyanga, but she contacted me. She was camped in Moshi, studying real 8 a.m. to 8 p.m. every day, Monday to Saturday. And I can't. I mean, it's a lot of dedication. And so it's really, I'm happy our path crossed. And Robbie is helping me a lot with mentoring people who are entering the process. She's real focused. She's doing excellent. And, Robbie, I pray for you. Hope everything goes well. I have some people from Uganda, the Pillar of Africa. Wilbrod Athlore is not here with us. Apparently in Uganda now they have no internet access. So I've not been in touch with him for the last 2 days. And of course, he told me internet is going to be shut down. And it seems that is what transpired. But we are with you in spirit. Is MD5, did his step one after MD4. So he's looking to do his CK immediately as he's graduating and probably apply for residence just after his internship, which is a very good timeline. So it's an excellent. In the middle is Ernest Naturinda. He's as well from Uganda. I met him in Kampala when I went to do my international elective, and he was working there with Baylor, Uganda kind of program. He's now doing pediatric cardiology fellowship in Southwest Texas. So when I met him, he had done step one. He was preparing for CK, and he was struggling with the process. And kind of I put fire in him. And a few months later, he texted me, I matched in Texas, I'm coming to do pediatrics. So you need to find people on the way to kind of, excite you in the right way so that you get your things done. On the rightmost is Amir Mbonde, who is from Uganda as well. Did his MD and MEd in Barara. He has done neurology at Mayo Clinic in Arizona and 2 fellowship in stroke. He did a fellowship in stroke at Harvard and then EEG fellowship at Mayo Clinic. So he's currently attending neurologist and faculty at the Medical College of Georgia, Augusta, Georgia. So thank you, Amir, for being a mentor. And this is a paper which Amir wrote when he was doing, I think, his residence, providing neurocritical care in resource-limited setting, challenges and opportunities. And really, for the people who we try to mentor, one of the key things we try to tell them is insisting on them doing sub-specialized training so that they can transfer the skills back home and we help our people. Some of you are aware that Dr. Minja really pioneered interventional radiology training in the Eastern African region. And it has turned out into a fellowship. It's very successful. It's treating thousands and thousands of patients. And this is kind of the thing we want to do, whereby you are highly trained and you can transfer the skills and kind of, be able to use them in the country, train our people and provide care to our people. So from the Pillar of Africa as well, I have Edith Nyangoma, born and raised in Uganda, did her MD at Makerere, completed MEd as well at Makerere before she moved to the US, initially doing Epidemic Intelligence Service Fellowship at CDC. So she did her residency in internal medicine at University of Minnesota. She had a call in last minute. She's doing now infectious disease fellowship. So she can't be here with us, but I didn't want to change my slides and remove her nevertheless. And I first communicated, I really wanted to share this because I think this is a slide which I'll put for the 301 when I talk to the people who are applying for residence. Because when I looked at it, because I was trying to think as I'm preparing this talk, is when did I meet Edith? So I met Edith in 2017. I was doing my 3rd year. And Edith saw my name when she was trying to explore residence in different places and trying to network and emailed me. And I just started my 3rd year, of course, and really her email stands out. If you look at it, this is the kind of email you should write to somebody when you're exploring opportunities. Very clear who she is, what she has done, what she's looking for, and what she's asking from me. Like ta. So this is classical, like it's the best of the best and how they come. We have communicated since then. She ended up matching University of Minnesota. We have been talking through, but guess what? It's 8 years. We have never met, but it's like we know each other. And that's what it is all about. It's mentoring, it's supporting, and it's moving on. So in this talk, we're going to talk about graduate medical education, which in other terms, it's referred as well as residency. So graduate medical education and residency is kind of interchangeable. So residency in the US is equivalent to MEd programs that we have in many countries around East and Central Africa. So, and unlike East Africa, whereby you finish your 5 years of medical school, you do a 1-year internship, you go and practice. In the US, in most cases, you do residency before you practice, which means that you practice as a specialist. So there's no really medical officers, but rather, either internist, pediatrician, radiologist, kind of, or gynecologists are practicing across the spectrum. So the residence in the US is done in the programs. And the programs can be either in a community hospital, in a university hospital. Sometimes clinics do have residence programs. But for MEd, it's almost always done, in the universities. And I said almost always for a reason that I'm going to explain. But what I want you to understand is the residence program, the person running it at the helm of the residence program is the program director. And then program director is assisted by associate program directors. And depending on the size of the program, they can have 2 or 3 associate program directors. And of course, you have a program coordinator who is kind of an administrator and the person who, in most cases, you'll be in touch with when you are doing your communications. And I said, like, MED is almost always done in the universities because starting from several years ago, there's this College of Surgeons of Eastern, Central, and Southern Africa, which has a residence in surgery, but is not affiliated with university. Kind of, they go through community hospitals, do rotations, they have preceptors, and people finish their surgical training. The same format, the way they do like the surgical training in the UK. So COSECA is there. It's headquartered in Jiro, Arusha. And so it's kind of a different compared to the other things. So to gain admission to do US graduate medical education, you need to take and pass your USMLE exams. And any medical students in a WHO, World Health Organization accredited medical school director can apply and take, USMLE exams. And I have provided a link to the World Directory of Medical Schools to kind of where you can go and see, if your school is there. And so when I ran the report for Tanzania, in the World Director of Medical School, there are 11 medical schools. You can real search by using country or by using your school name. But then you see when you look on the schools, they have what they call sponsor notes. And the sponsor notes is a brief description of the school, when it started, awarding degree, all the nitty bit of few details. And when I look for Tanzanian schools, the University of Dar es Salaam, Mbeya, St. Francis and St. Joseph do not have sponsor notes. I hear there's another school called Mwanza University Medical School, which is not even there in the WHO Medical School. So you guys, you need to explore and find out how do you put your school in there. And I don't know. I've never done it. Muimbili was there when I started. So don't ask me a question because I won't be able to answer you. Rwanda, they have 3 medical schools. And I think there is only sponsor notes for one school, the University of Rwanda College of Medicine and Health Sciences. The other 2 do not have sponsor notes, so which means they are not listed in the directory. In Kenya, they have 11 medical schools. And there is a Uzima University College in Kisumu. It has no sponsor notes, so I think it's a new medical school. If there's anybody from Uzima, kind of, think of being a pioneer and putting your school in there. So I looked, Mount Kenya University School of Health Sciences was updated in 2022. So it's a pretty new medical school and it's there in the system. So if you know somebody from Mount Kenya and from Uzima, you can kind of engage them and find out what they did and kind of, plug and play in such a way that you have it in your system. So for Uganda, they have 9 medical schools. And as I said, just Google the World Directory of Medical Schools. Look for sponsor notes. You can see if you are having any problems, you can send an email to USMLE Pursuit. I know people who have done this for their schools, and we can kind of connect you, share the information in such a way that you can do the right thing. The graduate medical education now, when you are done with the exams, when you are done with your USMLE, then you go and apply, and you apply for residence through ERAS. And ERAS stands for Electronic Residency Application System. That's where you put your application, your CV, your everything, and you ready. And those are the things we talk about on 301 once you're done with your exam. And then you apply for matching through the NRMP, National Residence Matching Program, a system which has been in place since 1952. So this is the 74th year NRMP has been in place. So the NRMP goes through computer randomization system, and people, are placed in different places to kind of go and start their residency in July. So the system is really created with specific timelines, like the applications open in September, interview done in November, December, ranking order list in February, March, the second Monday of March, July 1st, new residents, new fellows pop in and they start their rotation. So it's pretty rigid and that's how it works. So before I tell you all these things about applying, errors, NRMP, everything, you need to get your situations in place. You need to take and pass your USMLE exams. So the application for USMLE now starts with my in-teeth ID. And I bolded and redded this because if you look on the last year's talk, here you'll find the USMLE number. And the USMLE number is off the window. They changed the system from ECFMG to my in-teeth, and that's where everything goes through. And my in-teeth ID is the process. Actually, we sent the previous recording to the people who were registered when we postponed and tell them to look through. And people were texting, like emailing, like, oh, this system does not work. I say, yeah, because it changed and it's part of the thing that you are talking on this year. So if you rely on last year's, you will miss on this information. But applying for really your MindTeeth ID is ground zero of where you kind of start your process. So before you go to my in-teeth and get your my in-teeth ID, you have to make sure that your names are in order. And before you could apply for USMLE number initially, you never needed any identifying information. You never needed your passport. But now through my in-teeth ID, you need to have your passport for you to be able to apply for my in-teeth ID. So which means what you need to make sure is the names you have in the passport matches the names you have registered for your medical school to the last alphabet. So in Tanzania, we are very casual with names. Somebody will say, I'm John Casey, will write Casey with K-E-S-S-Y. And at some other places, will write Casey with K-E-S-S-I. And another one will use single S with I. But these are completely different three people. Or somebody will call himself Mohammed with double A, Mohammed with single A, Mohammed with I at the end, Muhammad with A. So these are four different names. So it's very important that you make sure that the name you have registered for your medical school, and this is good if you're a medical student, you change your name in such a way that it reflects what you have in your passport to the last alphabet. And me, I'm a victim. I mean, I kind of survived in this system of using name cavalierly, and I like using myself as an example. When I was born, my mom was very excited. She gave me 5 names: James, Ignas, Bahati, Tadei, Koola. So when I went to secondary school, I just used James Ignas. You go to my certificates, Form 4, Form 6 is just James Ignas. Then I went to medical school. They say, oh, you need a third name. So I said James Ignas Bahati. Now I'm applying for USMLE and I had to streamline and say, this is James Ignas Koola, so James Ignas Bahati Tadei Koola, James Ignas Bahati, whatever, they don't exist. This is James Ignas Koola. So you do the deed poll, publish in the government gazette, remove all the controversies. So it's very important you do that. And I think around East Africa, we do the same through your lawyer friends. You have been giving them, free medical treatments and diagnoses. Now is the attempt to pay you back. Tell them, to help you streamline your names. And just be very watchful. There are names which people are more cavalier in changing than others, where you'll find Mary with M-E-R-R-Y, and then Mary with M-A-R-R-Y, and then Mary with double R-Y. Just make sure that your name aligns in such a way that you don't go into any trouble. So the registration journey starts with my in-teeth app. This is where you will go. We'll share this link when we send the summary of this meeting. And for international medical graduates, once you're a medical student, you can log in and start the process. And of course, once you start the process, you can take your exams, and there's no restriction really. And And I said IMG, International Medical Graduates, because another group is called American Medical Graduates. And American Medical Graduates are the people who finished their medical training in the US. So you can be a Sri Lankan who did your medical school in the US, you're an American medical graduate. You can be a US citizen, born and raised, but you went to do your medical training in Poland, you are an international medical graduate. So international medical graduate and American medical graduate has nothing to do with residence, has something to do with where you trained, relative to where you trained. So as I said, although you are allowed to take your exams as soon as you get your in-teeth portfolio and everything, I will strongly advise that you don't take your exams until you are done with at least your first clinical year. And there's people who have done it, like Omar. When I was introducing him, I say he did it in MD3, but it's very challenging. And I'll try to explain, especially when we talk about 201 on how to prepare for the exam and everything else. It's challenging according to our training to be able to take and pass real step one well before we do our clinical training. So I went and did some screenshots on my in-teeth. So you go, you say you don't have my in-teeth account, and kind of if you don't have, as you are starting to kind of create your account, and of course you can verify yourself. So if you already applied for a USMLE number through ECFMG, you do not apply for a new USMLE number. You don't apply for a new in-teeth ID as a new person. So you have to go in there, you put your email, the email that you use to create your USMLE number, you have to have access to it. So you put that email there, and then they'll send you a verification. You will activate and they will link your accounts. Do not try to lie and think like, because it's my in-teeth, I'm going to say no, open a new email, it's free email, and then go and get a new number. They will figure out, and you don't want to be caught. So don't try that. I found a video, which I'm going to share the link as well, kind of explaining the process in summary, how to go through my in-teeth. And I will share with the information. And as I was trying to find this and familiarize myself, I came through these two YouTube videos where they tried to explain the changes between ECFMG and my in-teeth, the key changes and differences of what happened. And they are very good kind of in explaining. In any way, shape or form, I don't endorse those people, but the information is really succinct. And I thought, I can share with you. So one thing I want you to understand is through this USMLE application process and residence training in general, you have to have the capacity to think above and beyond. In Swahili, we have a very good word for it. Lazima uweze kujiongeza. Kujiongeza. It's a Swahili. So you have to be able to apply yourself. So it's very important, like when you hit a hurdle, you kind of pause, because now with internet, Google and everything, it's hardly that there's a problem that nobody has faced it in this world. So try to be diligent, find information, and be creative. So you apply for my teeth ID only once. Is the only number you will use when you decide to pursue USMLE. Never ever create another my in-teeth ID. You can change your names, you can change your gender if you want, you can change whatever, but my in-teeth ID will remain the same. So just tell them I changed my name, I changed this, and they will change it, but your number will be constant. So the USMLE number used to be free, but now with my in-teeth ID, you need to pay $100 to be able to get my in-teeth ID. So what they have done is they have front-loaded the expenses. And actually, for you to take the exam, you have to finish your verification, which goes to like $650. Before, you didn't need to do that. But in those videos, which I'm sharing, at some point, they have created like a table. They are showing my in-teeth and the previous ECFMG. And the difference between the two processes is just $50. What happened is they put the cost before in such a way, because they are hosting all these profiles in the in the cloud, and they don't want to have people there who are not doing anything. So you need to have your skin in the game to come in. So I was real guilty of judging people's seriousness according to how quickly they get the USMLE number / now my INTITH ID. And of course, it's your passport if you want to be involved in the other sessions. So the ball is totally on your court. So I will have people send their family members. I'll talk to them for 3 hours till my neck vessels are dilated. And then 3 months later, I'll ask them, hey, do you have USMLE number? Say, oh, I'm still waiting. I mean, you know, 99.99% in 2 years, they will not be done. They will never do it. And through my experience for the last 3 years, we talked to around 600 people. Only like 10% get their USMLE number done. This was when it was free. So I have a natural experiment where I'm going to see now with where people are coughing money, how much am I going to have for the 201 and moving forward. So it's an interesting natural experiment that is happening that I can't wait to explore and kind of write about it. So you get your My INTITH ID, and of course, My INTITH kind of send a form to your dean. Now it's done electronically. It's no longer through postal service. And of course, if you graduate, you have to update with your medical certificate. You can do this as a medical student, but as soon as you graduate, you send your medical certificate so that it's verified that you are a graduate. So the process takes time. There's a lot which is not under your control. So it's really important that you start the process early, but also you don't need to start the process to finish the process so that you start studying. So immediately start studying as the process is going along. Really, it depends on the speed of your dean office. Is the dean in office the one who is verified? I was giving an example. I started the process when the dean was Professor Karim, the pediatrician. And I was finishing the process. The dean was Professor Kaya. Karim had changed, and Kaya was dean but was not verified. So I had to go through ECFMG to verify Professor Kaya so that she can sign my paperwork. So, I mean, if your school has no officers, your school is not registered, don't go into a fetal position, dejected, and accept defeat. Stand up, put your school in the map. It's no time to be lame. Be bold and get it done. Once you are done with your document verification, they are valid for life. What you have to know is your exam expires after 7 years since when you get the result of the first exam. So let's say you get my INTITH ID in MD1. And then in MD5, in your internship year, which is year 6, you do your step 1. Your step 1 will expire 7 years after you have done it. But your verified document will continue to be verified throughout. So it's very important to take that into consideration. That's why you need to be done with the process as soon as you can. There's no reason to procrastinate. When you are in school, you are there, you are meeting your dean, he's teaching you, you can kind of get your things done. I cannot really overemphasize the importance of doing this. It's very deflating when you are ready for the exam and then it happens due to logistic reasons, you cannot take the exam. When you are ready, you are ready and you want to take the exam. So don't sabotage yourself. Just make sure that you are there and ready to do it. USMLE Step 1 exam is basic sciences, anatomy, physiology, biochemistry, all the sweet things of basic sciences. Currently, it's a pass-fail exam. But there's a lot of Step 1 in Step 2 CK. So preparing well for Step 1 and passing it to the best of your ability really puts you in a prime position to pass well in Step 2 CK, which is a scored exam. So it's very important that you take your preparation very seriously. Although Step 1 is basic science, my personal experience is you'll do much better when you have done some clinical rotations. Why? Because the basic science is basic applied. It's integrated basic science. In the US, starting from year 1, MD1, they start going to the clinic. So they start integrating clinical within their basic sciences. When I did my training in Muhimbili in the first 3 years, I never touched a patient. Actually in third year, we do management of disease, which is how to see patients and like whatever. But that course never had university exam, and it was our time to kind of procrastinate. So we never even paid so much attention. So I think for somebody, I know people who attempted it after their third year, and most of them failed. As so far, I know Omar who did and passed real well, but everybody is not Omar. I don't think I was ready to do and pass my step one when I finished my third year. I'll never have made it. Nisinge toboa. Okay? So don't experiment on yourself. Get your things done. Do your first rotations in fourth year, and then you can take it confidently. Step 2 CK is really clinical, internal medicine, peds surgery. The exam is predominantly internal medicine, like 60%. Most USMLE questions are third degree level of knowledge, where you need to know A, to know B, to answer C, or to know A, to know B, to know C, to answer D. They are solid MCQ questions. So I had such a cavalier approach to multiple choice questions. I never used to respect them, but when I prepare for USMLE, I respected the robustness with which, MCQ questions can be written. A well-written MCQ question is no match, like it's the best of the best. So one of the example I have of a really USMLE question is this. There's a 4 years old African-American boy who's presented to the hospital for the fourth time in 6 months. So has recurrent readmission. Previous 3 visits, he had swelling of the fingers and orange coloration of the eyes. This time he has pain below the knee. X-ray is showing evidence of periosteal elevation. You are given different labs like normal electrolytes, some transaminitis, slight elevated bilirubin, you see some anemia. And then, of course, CBC is normal. And then you are told a biopsy is taken from the lesion. What's the gram stain of the most common organism? That can be a step 1 question. Or they can tell you a biopsy is taken, what is the next best step? And that will be a CK question. So you see the way you need to know your basic sciences. So this is an African-American boy, yellowish coloration, swelling of fingers, that's dactylitis, that is jaundice, is having periosteal elevation, he has some osteomyelitis in there, and you think, what causes common organism for osteomyelitis in C class is salmonella, which is gram negative. But you are using your microbiology to answer what is the next step in management. And these USMLE questions, they don't mention any kind of diagnosis to you. They don't use any bombardic. They describe everything. So you figure one, you figure the second, you figure the third, you answer the fourth. You don't know any of these, you are doing a complete guesswork. So it's very important that as you prepare using USMLE-specific materials. You have, your school in your fingertips, and you can do well. So for CK, the median score for American medical graduates now is 249. So what you are trying to do when you prepare for CK, you want to beat that median score of American medical graduates. And that's how you position yourself. I know programs that filter candidates. If you have score of less than 230 in CK, they don't even look at your application. So in ERAS, you can filter and decide who you want to see. And that's how you can kind of kick out the people you don't want to see. So you need to do step 1 and step 2 CK plus an English test for you to be ECFMG certified. And that one, ECFMG certification, that's what will enable you as an international medical graduate to apply for residence through ERAS. So step 3, you don't need to do, but I will advise and very strongly, and when I'll talk about in 203, in 201 and 301, is really when you do it, it kind of gives you an advantage. And, and I advise people to take it before they start residence. Step 1 and step 2 can be done in Nairobi and Kampala. So guys, in East Africa, we have 2 centers. If you're in Nairobi, you just take Matatu and go and write your step 1 and step 2 CK. If you're in Kampala, the same. If you're in Tanzania, you just take a bus, you go to Nairobi and take your exam. So we are real blessed in East Africa with 2 centers. Other centers in Africa, we have another center in Accra, Ghana, in Sub-Saharan Africa, and another one in South Africa. So those people from Botswana, Zimbabwe, they can go to South Africa those people from the east, they can move north and do everything else. So yeah, so there have been news like people, there are states which are allowing people who have graduate training, MEd training, like outside the US to kind of come and practice in the US. And people were kind of texting me like, oh, we don't need to do USMLE. I will go and practice. I told them, I pop their bubble and tell them, relax, relax. Actually, even if you've done your specialty training, they are also wants to see that you are ECFMG certified. So it's you cannot move from Arumeru or Kakamega and you land in Knoxville, Tennessee, and you are starting to see patients and you are not done even with your ECFMG certification. So as I said, step 3 real shows the PDs that you are ready for full residence training, and it's something that can give you advantage over the rest. So when you are done with the 2 steps and the English exam, you get ECFMG certification, which you can use, although even if you don't match in the US, it can be used in other countries to kind of do training / practice, because it real standardizes your education that is at par. So, given the uniqueness of USMLE questions, the way you train and study needs to use USMLE-specific materials. Reading books, Snail, Gatton, whatever, Straya will not cut it. So you need to have USMLE-specific materials to prepare. You need to have a specific way to prepare. And this is a whole session that we do on 201 to kind of tell people, the proven ways that have shown people, to get the 250s, the 260s, and 270s, to be able to pass the exam. So the first thing really is the first aid, which is a quick summary of USMLE. You need to read it multiple times. Reading first aid alone will not make you pass exam. You'll just fail. But you need to be able to combat everything. That I will take you through. It's almost a 1-hour session to go through. So the first aid, they bring new version each year. This was 2025 version. But basic science really does not change much. You need to have a first aid book. You need to use it. You need to write everywhere, annotate, highlight. By the time you are taking the exam, there's nowhere to write. You need to know that book A to Z. Once you have a book, you don't really need to update it. As I said, basic science really does not change much. Ground stain is the same since when it was 100 years ago when it was discovered. I'm not sure when, but there's no much change. And the newer version are more expensive. Like this one, 2025 is like $72. But if you go to Amazon, you can buy a 2020 version for $20. And really, if you master it well, it doesn't matter. It's a 2020 or it's a 2025. You can be there and you can do. And there are people who buy the soft copies. I know there are people who like reading soft copies, and they told me they can annotate. I'm old school. I'm hardcore page. I want to turn my pages. That's how I study. But people have been getting even the e-copies. So why all these hassles? I mean, why all these hassles? Go through the process, study yourself like this. Preparing for USMLE enhances your medical knowledge. You are able to integrate things more. You are a knowledgeable doctor. A knowledgeable doctor is a better doctor all the time. You are confident. When you have your knowledge, you can teach, you can lead, you're not scared. You're not trying to hide and find your way somewhere in a corner. So what I say is the eyes does not see what the brain does not know. If you don't have knowledge, you will see and think this is a rash, and somebody will look and say that is a celiac disease. You look on a CT scan and say, oh, somebody, you have a colon mass, and somebody will look at it and say that's an interception. It's not really a mass. So when you don't have the knowledge, you are anxious, you're not sure, you are second guessing yourself. But when you invest and study and gain the knowledge, example, as you are going through the USMLE preparation, you make yourself the best of the best. As a medical educator, somebody who I deal with residents and medical students, I will tell you, I can smell a knowledgeable physician from far away. And it's so much different dealing with somebody who has medical knowledge and somebody who does not. So give yourself some mercy and prepare yourself and make sure that you're good. The USMLE exam, as I said, you really need to prepare in the USMLE style And we don't want you to fail due to lack of strategy. And that will be doing in 201, giving you the strategy. Because if you look, 98% of American medical graduates passes the exam in the first attempt. So it's like, it's not a hard exam. But if you don't prepare in the right way, I will assure you 101% you will fail. So it's very important that you use the skills. And of course, as you're a medical student now or you're a physician, the moment you decided to be a physician, you're a student for life. So studying is part and parcel of our life. COVID came. We never studied COVID in medical school, but COVID came. We learned about it. We diagnosed, we treated it, and we moved on. And that's what to be a physician is all about. The moment you choose to be a physician, you are a student for life, and that's something you have to embrace, enjoy it, and do it well. When you prepare for USMLE exam, for those people in Tanzania, we have pre-intern and post-intern exam. Nobody who has been in the preparation process has failed these exams. Actually, they finish it very quickly in less than half the time that is allocated. And they come and they tell me, Dr. Koola, the exam was so simple. It's because their knowledge, they can integrate things and they can do it very well. So, and even when they go, I had somebody who was doing USMLE and went and took the certification exam in Namibia. He passed so well in such a way that the medical board called him like, how did you manage to pass this? We've never seen these scores. And like, oh, I'm preparing for USMLE. So, so it gives you that edge whereby you can play in the big grounds and be able to demonstrate and use your skills. Remember, I said residency is similar to USMLE, but different. Residency is similar to MEd, but different. Unlike NMED, where you pay fees, once you march into residency program in the US, you start receiving salary. So residency is funded by Medicare. And so because you are there, you are providing care. So, someone is paying for you to be trained. So you can bargain with your sponsors, your parents, and tell them, instead of paying my fees for MEd, I can use the funds to prepare for USMLE. I'm a medical student, and when I finish my internship or I join residence, I start getting paid salary and I move on. And they make some money, 5,000 to 8,000 US dollars a month, like 13 million Tanzanian shillings a month. I mean, they can live a decent life, So you'll be independent. You won't be asking for money. Frankly speaking, growing up, one of the things I hated is asking for handouts. So I couldn't wait to be independent and make my own money, but we are different. So training in the US give you exposure to highly specialized training. You can get skills and transfer them back home. You see what I talked about Dr. Minja doing, Amir Mbonde doing, and different people kind of, transferring the skills. You come here, you do residency in internal medicine, and then you do fellowship in cardiology. You can go and do electrophysiology, you just deal with electrical activity of the brain. Or you come, you do neurology as a residency, and then you do neurocritical care, you do endovascular intervention, People do pathology. They go, they do dermatopathology, molecular pathology, Pathology is so wide. It's not only about doing cadavers and postmortem. It's so wide. One of our panelists, Magacha, is going to do GI and do endoscopic certification. So you come in, you have a biliary stone, you have cholangitis, your pressure is tanking. He do ERCP on you. He remove the stone, you live to die another day. So those highly specialized training you can have access to, and these are things that we don't have. They are not that robust at home, and we look forward to transfer that skill at home and help our people, So that's really important why you should think you should do this. So as a US trained and certified physician, you can practice in many countries without doing exams. So ACGM has a very robust accreditation system for the program and the way people are training. So the trainees are very solid and they can, integrate and work across the board. And you train, you are really supported. The educators, we want to see you succeed. So it's our number one, to see you finish and pass. And so you are there, you are real supported, and it's an amazing experience. So after this session, probably around March, I bought the first weekend, but now it's mid-January, so probably we'll give you guys 2 months. Around there, coming to the mid-March, we'll have the 201 session. So unlike the previous sessions, like this session, whereby we advertised broadly, everybody, you just register and come. You will come to 201 session only if you have your INTITH ID / USMLE number. You don't have, we don't want to see you. So this will be by invitation only. Is a group of people who are in the process, and what we'll try to do there is to go in depth to share the experiences of how to prepare for the USMLE exam, the materials, the everything, how to position, how do you know that you are ready, and among everything else. So if you don't have my INTITH ID, why should I tell you how to prepare? So it's really your effort kind of give you an avenue to go there. So around May, the first week, we'll kind of have the 301 session where we talk about the application process, how to strengthen your application, how to position yourself, how the clinical experiences, how to write your things, how do you interview, a scoop from the inside the program. What are we looking for? But for you guys, you are just starting the process. And of course, at that point, you are ECFMG certified and you are looking to apply. And that's where we kind of really open it up. So when you get your INTITH ID, send it to usmlepursuit@gmail.com. If one of the panelists can take it and write it in the chat. That's your go-to email. As I said, don't Google me, don't tag me anywhere. Go to USMLE Pursuit. We kind of pride ourselves to respond to all the emails that goes through USMLE Pursuit. So it's really a good way to communicate that help us to kind of, put everybody together and be able to help as many people as possible. We, as supporting you through this preparation, we don't do any social media groups, no WhatsApp, no Telegram. We don't. It's real high email communication. Our philosophy is you need to apply yourself. You need to make this decision. You need to work on yourself, and you really need to learn how to apply yourself and kind of ask key questions, and we are there to support you. Our job is not to convince you to do your USMLE. We are looking for people who convince themselves that's what they want to do. And what we try to do is to show you how can you streamline the process in such a way that you can do it as quickly as you can do it. You can position yourself in a prime position, to compete internationally and be able, to gain access into graduate medical education. So if you decide this is what you want to do, one thing you need to do as you go through your training, start looking for ways whereby in your 4th year you can come to the US and do electives, get some US clinical experience, get to see patients. Now, if you have been preparing for USMLE, which means you are a real good medical student, you know your things, you're going to come, you're going to, present patient, discuss and do everything else, impress, make people, give you reference letters with enthusiasm / want to recruit you. So you need also to explore the collaborations that you have. Yeah, your schools, have universities that they collaborate with. So avail yourself to make interaction and make connection. We are human. Human beings are social animals. So just be there. Just there, build positive relationships. So Dr. Amir Mbonde, who I talked about, was doing MMed in internal medicine when a neurologist visited from Mayo Clinic, Arizona, to his medical school in Barara. And, he met, they are talking like, I'm interested in neurology, and like, yeah, do your exams. And he did his exams and he matched there. So you need to position yourself to build positive relationships, and that will give you, that advantage when it comes to the time that you're applying and you're doing it with intention. So this was 2024. They were MD4 students, Clara and Brendan. From Muhimbili. They came to Dartmouth for 7 weeks. And a colleague of mine, Dr. Frankie Kusaga, kind of put them on the train. They came to spend a weekend with me. I gave them a quick tour of Yale. This is in front of Harvey Cushing Library. And it is named after Harvey Cushing, who was an American neurosurgeon and faculty at Yale. is the person who described Cushing syndrome. So you read about Cushing syndrome, we are in front of Cushing Library, you know. So it's just for the sake of trying to give people exposure and get to see the things that they can do. Please note down the email. Send us my INTITH ID as soon as you can. We'll create a cohort. We put people in the numbers and we'll invite you for 201 if you are ready. And then, of course, we don't advertise 201. It's by merit, and that's what we look forward to. And thank you very much.
Santa, Dr. Ignas. That was a whirlwind. Tons of like really, really great information there. I hope this resonates with those who are already thinking about applying. One of the things that we will do moving forward is capturing which year you are in your training, because really one of the things that we've realized it's really great that people have this information as early as possible in your medical training. And ideally, you'd be a first year medical school student, and you're hearing about this. And so basically, you can begin your USMLE journey and basically start studying earlier on during your training. I see a couple of questions here. I'll ask Dr. Ignas to kind of chime in. This came in, and then basically, as we have more questions, please just raise your hand. You can ask your question, you can put it in the chat. The rest of the hour is really just answering whatever other things that we have not covered. So kindly, can you talk about visa restricted countries with all these new restrictions for immigration to the United States?
Do you want me to answer? You're gonna
Yeah,
answer.
yeah. What do you think? Yeah.
So I mean, don't put the cart in front of the horse. This is a process. It's a long process. What I will say is last year, international out of the 40,000 residents who marched in July 1st of 2025, more than 10,000 were international medical graduates. And these are the people who come to train. You know, when you train for residents, it's not like you sit and have PowerPoint running. You see patients, you know, so you are part and parcel of care providing team. And that's why Medicare pays for you. So the way I look at it, all these restrictions coming through, I will try to give you advice, which we are talking in-house before we started the session. And they say, just try to stay away from CNN. You know, what you are hearing there, stay away and focus on your things. The key thing is IMG are needed in the system. They will provide a caveat. When you are ready, you'll take that opportunity. If you try to sit in a fetal position and say, I'm defeated, yeah, you are defeated the moment you accept it. So just prepare, get ready, and I'm sure things will open up.
Yeah. That's a great point, and I tend to have the same philosophy. Again, if you're starting right now, and let's say you're an MD1 student, in 5 years, the current administration will not be the current administration, right? So the elections are going to be in 2028 in another like 2 years. So you'll be finishing medical school in 2031. Who knows who's going to be in power in 2031 or 2032? We have no idea. There may be two administrations by the time you are actually ready to go to medical school, which is why we really like to talk to people very early. And so chances are, if you're MD1, you'll be applying 6 years from today, right? And that's already like two US presidents from the moment we're talking like right now. And we have no idea what's going to happen. So one, position yourself just to be the best medical student you can be, which will position you to be the best medical doctor you can be. And even if it's not to the United States, many other countries really, really want highly qualified and highly trained physicians. So you can go anywhere. So maybe it's not the US, you can certainly go to Canada, you can go to the United Kingdom, you can go to Australia, and you can like work in Africa as well. But you will be a better doctor for having gone through this process. And that's why we really, really emphasize this as a way to standardize our medical education. It would be nice, really, that if our schools, medical schools on the continent, adopted this USMLE training and format, so that way everybody will be receiving the same level and rigor of training as they're going through their medical school and so forth. So great for answering that. If anybody else has something to chime in, please just raise your hand and we'll kind of allow you to kind of chime in. The next question was, why do we not have exam centers in Tanzania?
I mean, it's what? There are four centers in all of Africa. So actually, Egyptian center is considered as Middle East, but then we
Mhm.
have Accra, Ghana, Nairobi, and Kampala. So and Johannesburg. So it's just I think it's the level of detail that is needed for a center to be accredited to run those exams. They
Mhm.
have their own standard, the way they put their things, and probably no investor has kind of stepped on the plate to do it. So
Mhm.
I'm not sure why it's not there, but we have 56 countries, almost 55, 56. I'm forgetting my geography in Africa. We have
55.
five centers. So it's, one for 11 countries. So what I'm saying is in East Africa, we are really lucky to have two centers. And you don't need to get on a plane to be ECFMG certified. So for me, that's a plus.
Excellent. Yeah, somebody just asked again about the visa ban. The visa ban is something that's temporary, and these things are gonna be changing. So really, you cannot really plan the rest of your life based on what's happening on the political level. I really, really caution everybody, and unfortunately, both social media and our news outlets tend to really, really amplify things, and that can really kind of get you psychologically. I myself was definitely toned down on my social media activity and just my exposure to that information because it's really not helpful. You really have to focus on your training and patient care. And that's always been a very good compass as you are trying to navigate difficult situations. You need to find things that can sort of anchor you. In our programs, we always focus on what is the training experience, what is the patient experience. And if you focus on those two things and try to optimize that, it will really help you a lot with navigating all of the other political noise. So, for example, what does the visa ban have to do with patient care? What does the visa ban have to do with the USMLE exam? It doesn't really have anything to do with that immediately. It may affect you in sort of your timeline. Maybe it'll lengthen your application process from 4 years to 5 years or 2 years to 3 years. But in the grand scheme of 30 years of practice, 1 or 2 years is not really anything. And we really believe probably there will be a carve out for physicians, as Dr. Ignas mentioned. There's a huge need for international medical graduates. So I think they're trying to navigate. They're trying to put the process in place. Yes, there's going to be a ton of changes, but we are the best people positioned to navigate those changes. So really, do not let that news discourage you. There will be many other things that will discourage you. But bottom line is these our patients are getting older, which means they need more medical care. So if anything, we will need more and more physicians moving forward and not less. And there is not enough supply within the U.S. System. So these systems of international medical graduates will continue to be a critical part of the workforce, helping to meet that demand. A good question here was, for people who cannot afford to do electives in the USA, are they still in a good position to match?
I mean, the key thing is we real value some US clinical experience, but that said, it's not cast on stone. And I will use an example. I know people who have matched without, and the first time they come to the US is when they're going to start their residence. And how did they leverage this? They are collaborating and they have attendings from the US who goes to their school. So what do? They present themselves, they work with them, they present cases, they show themselves, they experience their enthusiasm. Guess what? Those people write letters for them. Me, when I get a letter from a US trained physician telling me about this race, I don't care they met in Kathmandu or they met in Algiers, Algeria. I know he can evaluate the things I'm looking for. I look, the things are there, and it's done. So you can do without, but it's been intentional and taking advantage of the opportunity. And they are there. The good thing is they are there and people don't take advantage of.
Yeah, highly. Yeah, I cannot say enough about that. As you're going through medical school, please be proactive. There are many volunteers that we send and help to send to countries on the continent, Tanzania, Uganda, and Rwanda. And these volunteers are going there ostensibly to do training. Some of them are there to do like research projects and whatnot. I would just advise all medical students to be proactive, to look for ways in which you can contribute. Let's say to contribute to part of their research, maybe contribute to like collecting data, but even contribute in a way to socialize, right? So anybody coming to a different country, you're lonely, you're a foreigner, right? You're looking for something to do on the weekend. You're looking for where to go to a good restaurant. Try to be a good host. The same way you would expect if you land here in the US that somebody would be a good host to you. So basically, some of these things, people, you just need to put yourself in that person's shoes and then understand, like, well, how would you feel if you landed in Tanzania? You don't speak Swahili, right? And everybody around you is speaking Swahili. All right, can you translate what's going on? Can you at least make that person feel more comfortable? And that's how you make human connection. And actually, being a physician, making human connection is the most important thing you do, because you may have all the knowledge, but if the patient doesn't trust you, it doesn't matter they have knowledge because they're not going to listen to you. So I think start practicing those skills and really think of them as human beings. You're trying to make a human connection. And usually, if you do that, coming to the US to do an elective is not 100%, but you definitely have to be very proactive to make up for that. And I will just say, it is very difficult to get an elective in the US, right? Here in the US, it's difficult for us to absorb US medical students who want to come and do observership, right? Let alone somebody from Tanzania. Here in Atlanta, I don't have enough spots for us to accommodate all the Emory, neurology, neurosurgery, ophthalmology. All these people want to come and like see neuroradiology, right? Then we have like folks from like, all the way to undergrad. Then I have like, folks from like, Morehouse School of Medicine. We don't have enough. I mean, we would just be doing observerships all day, all night, right? So those spots are very, very, very limited. So I wouldn't really count on that and really look around you first. And again, given all the visa ban, actually, that's probably gonna make it fairly impossible for you to get that, at least in the near term. I mean, it may change in the future, but again, just be creative around yourself and see what else can you do. Because yeah, there's clearly research going on, there are clearly volunteers going on, and there are always opportunities for you to assist. But maybe Magacha and Mohammed, maybe you guys can weigh in on this elective, because this question always keeps coming up in our sessions. Over.
I think that's a very good question. I mean, I've been I'm in third year of residency, and I've seen people who march into our program without even they've never done any electives here in the US. So it doesn't mean that you have to do electives in the US for you to march into residency. The only thing that you get from electives is just that you get experience, yes, and you may get some letters of recommendation, but you don't really need electives for you to march into residency. You can still match without doing electives here.
Got it. Awesome. How about Mohammed? Yep.
So yeah, I echo that. And electives, I probably put myself in the position where I wouldn't have been financially capable of coming to do an elective. And so I understand many people don't really have that ability. And you cut your cloth according to cut your dress according to your cloth. To echo what I think Dr. Koola and you had said earlier on, there are collaborations that are there between programs here in the US, and I'll give you examples in Kenya because that's what I know. The University of Washington has like a site at the University of Nairobi. They usually deal with epidemiology and stuff like that. But it is an opportunity where if you go, closed mouths don't get fed. So you just walk in there and say, hey, I wanted to do an elective. I wanted to do this. Can you connect me with something like that? Earlier on, I wanted to do orthopedic surgery. And so I remember when I was doing my orthopedic surgery rotation, we had doctors from, was it North Dakota or somewhere? I think it was North Dakota. And they had come like for a mission. So they were doing like a camp in Kenya and they were treating our patients at KNH, Kenyatta National Hospital. And so the entire week I was with them there. And I really liked them. We talked a lot, but they didn't have a residency program attached to their hospitals. I think they only had one or something. And so either way, those opportunities exist. If you are in Moi University, actually Moi has more connections with the US. They go for the AMPATH rotation. But if you don't have the ability to go to AMPATH, because I know that's a limited amount of people,
some of the attendings come to Kenya from Indiana University, from Brown, and so you work with them in Moi, and so the letter is still valid. Well, and it's cheaper. And I think these are the things I learned when I came here that necessarily, if I had known, I would have taken advantage of. I know one Ugandan student who is currently fifth year, or is it sixth year? I don't know. Uganda, do you do 6 or 5 years?
They
Anyway,
do
he's
six.
he's a final year student, and he is currently applying. We're good friends, and he's done rotations at the University of Minnesota through his university, and so those opportunities are there. They will pay for your travel, but you have to look for them.
Awesome, awesome, awesome. Great stuff. Great insights. Mongari, did you want anything to add there, or we'll go to the next question?
Yeah, I think I can comment on this question as well because
Yeah.
it's a very common question. Bottom line, you do not need a medical elective, and the answer that seems to resonate is there's so many different possibilities, and I'll give real life examples, including mine. So a very good friend of mine is doing his residency at the University of Washington in medicine, and how he ended up coming and matching such a great program is that after finishing his USMLE, getting his ECFMG certified, he got a research fellowship, which is something you can apply into once you get ECFMG certified. And the process of engaging with other collaborators and doing research in the US, that sort of contributes to your experience. And when you get into a research fellowship, you don't have to use your own money. It's funded, they're paying for you, they're accommodating you. And you not only end up being a researcher, but you also contribute to your clinical experience. Number two, which is something that happened to me, is this international research collaboration. So before coming to the US, I did spend some time at the Aga Khan in Nairobi. And there is this international researcher who had Kenya as one of its sites. And, during the data collection, we would interact. And during one of our interactions, I, mentioned to him in passing that, hey, I have done my USMLE step 1, step 2, I'm ECFMG certified. How can you assist me with this process? And, having collaborated with him, having worked with him for a month or two, we knew each other in a way. He knew my work ethic, and he was able to write a recommendation letter for me. This was a leader in the field of neurology, and in a lot of ways was able to really solidify and strengthen my application. Again, no elective, no clinical experience in the US, just an interaction over email with someone who had seen me work. And it was an unplanned interaction. And then finally, when I did my internship many years ago in Kenya, there's a small town called Chogoria. The orthopedic there actually lives in Durham. And when I told him that I'd marched into the program here in Durham, he looked for me. He came here and helped me settle. So, those interactions, those soft skills, they go a long way, and they go beyond simply, oh, you need to do a medical elective. It's a simple checkbox. And once you do that, everything falls in place. It's a lot of, being ready for the opportunity. That means having step 1, having step 2, being ECFMG certified, and being able to notice opportunities around you and leveraging them. There's no one way that or one checkbox that fits it all, or one pathway that fits the book.
Awesome, awesome. Great insights. Thank you so much for sharing that. Great insights. Thank you so much, Mongari. Another question here is on the timing for the USMLE. Dr. Ignas, maybe you can answer this. You may have answered it before as well. And at the same time, how many times during the year can people do the USMLE step 1? So the question here was, I think you had mentioned that taking step 1 should be done 1 year after 1 year of clinical rotations, so which is year 4 in Kenya. So the question is, should they apply now as a second year student or wait until year 4? What do you say about that? And how many times during the year could you take the USMLE step 1?
Okay, so apply today. Don't even waste your time to wait anything. Go to my Intith, go to your ID today. You need to get it so that you can come, and in 201 we'll tell you how to study for the exam. So it's very, very important. Don't waste a single second. So the exam is done throughout the year, except I think they close for holiday from the second week of December to like the first week of January. But throughout the year, the exam is going on. It's first come, first served. You just pick a slot and do your exam. So that answers that question. And
So meaning the dates are rolling, like any weekend you
yeah,
can.
the dates are rolling. It's open. It's 365
Oh
days.
wow.
The exam is on, except when the session, the center closes.
Nice.
Yeah.
Okay.
Yeah. So get your my in-teeth ID today, please. If I didn't emphasize enough, start the process, get it. And then I said, after you have done your fourth year, because I want you to be able to integrate the basic and the clinical more. So there are people like Omar who will do it MD3 and pass, but most people don't. Is this?
Yeah, it's okay. Yep, got it.
Okay, so it's very important that it's a process. So you start preparing, you make yourself better, you are able to compete, and so do it early, do it today. I don't know, did I miss part of the question?
No. That's perfect. I think maybe they are combining the two questions as to whether they should register today and whether they should do the exam as MD2. So I think you've clarified that. If not, they can ask it again. I would tend to agree with Dr. James. It is unfortunate now that you need money to start the process. In the years past, it was really initiative because the USMLE number was free. Unfortunately, now there's some money that's involved in that, but again, it's well worth it. And if you can find the means to do that, highly recommend just committing to the process so you can really be in there. And there's something about actually putting your money in there, which will probably help you be a little bit more focused. Because usually when you get things for free, you may kind of take it for granted. But now you're gonna put in whatever, $500 or something. I think you're gonna pay a lot more attention and you'll be a lot more serious. And so it is actually another way for you to actually really commit to the process. Magacha, you wanna weigh in on that in terms of getting started?
The right thing for you to do is just get prepared as soon as you can. And I know there's a
I think he or she was asking again. I think it's maybe the money issue because we're asking, I guess I don't need to apply for my in-tilth ID because I guess you're putting in your 500 now, but then you're not really gonna do the exam for 2 years. So, I, James, what do you think about that? So is there
So,
a question of, one second, is there a question of you can start studying now, collect that 500, whenever you have the 500, then you sort of apply for my in-tilth.
let me explain. So the key my in-teeth ID is $100.
Okay.
That's with $100 you get my in-teeth ID, which is equivalent to USMLE numbers. But
Okay.
immediately after getting it, you can move ahead and do some verification process that costs like $560. The videos are explaining it well. So my thing is, if you are MD2 and you are thinking this is what you want to do, and the plan is, as I'll be telling you on 201, is you want to study for your medical school and the USMLE concurrently in such a way that you come up integrating your knowledge in such a way that you are so good. And so, which means you need to come to my 201. And I'm not going to invite you to my 201 unless I see your USMLE number or your my 80th ID. So if you want to sit in the fence, good luck. Continue sitting on the fence. But the key thing is, it's $100. You get it. We'll invite you for 201. We'll let you know how to prepare. And I think that's the approach should be. And what you are trying to do is you have this knowledge early, start preparing early, be the best you can be.
Great. Awesome. All right, I think we've kind of beaten that to the ground. All right, another question that keeps coming up: minimum number of research publications one should have.
Nobody cares, Make
yeah.
sure you do the first thing that will bring you in is your scores. So you have a score of passing score for CK is 214. So you have 215 and then you have 60 publication, and somebody has 265 with 2 publication. Nobody will look at your 60 First, you won't even they won't even have time to look at your application.
Correct.
So the
Yeah.
key thing is have solid medical knowledge, pass your thing well. You can publish 2-3 papers well and good. Prepare your track record. You seems you are engaged. What does a paper tell me? I don't even look at what you write, how meaningful it is. When you publish a paper, what it tells me is you can start a project and finish it.
Exactly.
And
But
that's a completely
that's not
different
a small.
kind.
I want to kind of like emphasize it's not a small thing, but also it should not be overblown. Okay, it's not a small thing in the sense of, for example, it would be helpful if you have 1 or 2 publications, especially if you don't have a U.S. clinical elective, right? Because it's telling us, one, you're able to collaborate. It's telling us that you're able to, again, start a project and see it to finish. Because many times the publication process will have reviews, will have edits, will have this. It's tedious, right? So to see it through until it gets published does take a certain amount of effort. And how does this translate to residency training? Is that we know when you start, you are likely to finish. Because again, for the program director's perspective, if it's a 3-year program, the last thing I want is somewhere around year 2 of the residency, you're like, I don't feel like finishing. That is a kiss of death, because then now they have to find somebody to kind of fill in your spot, and so to speak. So it's a marker for you being dependable. It's a marker for you being reliable. On the other hand, don't do 100 publications. Right? The same way with the board scores, actually. I kind of feel the same way. If somebody gets a 250, it's enough. You don't need 260 whatever, right? Like, it just tells me that you are very strong. I don't need you to get, like, I don't know, I think like the max score is like 270 whatever. I don't think you need to aim that, but you need to be like, scores is not an issue. Like, board exams is not an issue. Like, you are a good, solid candidate. I don't know, James, whether you guys are, like, what are your thoughts around the range of board scores and, like, people getting like the maximum score and all of that? Like, what's your sense about that?
The issue is don't delay your exam because you're looking for a magic score. You're studying for 2 years for you to get to 80. You're wasting your time because also the clock is running. The sooner you apply after graduation, the better. So it's and as long as you beat the American medical graduate median, you're a solid candidate. So it's really doing the soft things, making sure your application in place, your application is good, have people look at. We talk on them on 301 in such a way you don't shoot yourself in the foot. You present yourself as a strong candidate who is ready for full graduate medical training. So I mean, you can get to 80, go ahead. Maximum is 300, Frank.
Whoa!
I've never heard of 3. I've seen her 285. I don't think I've seen.
All right. Yeah, no, yeah. So usually the highest we see is in the 260s. But even that is like way, way out there. I think like, anywhere above 240, 250 is a very solid number. And I think if you get that, and also if you're getting consistently across the different steps, is another thing for our international medical graduates, because again, step 1 is now pass fail. So you've lost the opportunity to kind of like distinguish yourself, right? So you want to pass, but we want to have good and high scores in your step 2 and step 3. So that's another thing that I like to see, that people are consistently hitting 240, 250 across all the different steps. It tells me that, one, they again have the discipline, they're putting in the work, and these guys are like solid candidates, rather than kind of like, getting like 255, 260, and then 220 in the following exam. It's kind of like, I guess you're not consistent in your effort, and that I don't think like bodes well. But yeah, so that's great. Magacha, any comments on that?
Yeah, I think going back to the question on research, you don't need, you remember, you are not a researcher, you're a physician.
Yeah.
And that depends. It's a kind of program specific. And, unless if you want to apply for the physician scientific research track, then you need a lot of research for you to be competitive. But otherwise, maybe 1 or 2 publications is enough, just to show something that you have something in your research. You're a physician. You're not research. You don't need 100 publications for your residency application. Score-wise, I think anything above 240. The median score nowadays is around 240, 250. So if you score around that or anything above that, you're good to go. You don't need 280s. I mean,
Okay.
but
Okay.
yeah, if you can get 280s, then go for it. But you
Yeah.
don't need it.
The other thing I would say also, when people hear research, okay, you have to hear funded research. So when these institutions say researcher, what we're saying is, are you being paid by the NIH to do research, right? But really, publication means scholarly output, and I think people need to kind of distinguish. For example, if you write a case report on a really amazing, interesting case you saw, that can generate a publication. That is scholarly output, right? So it's the process of being in the scholarly output. Research here, really, when we say research in the United States, we mean funded research. Are you getting an R1 grant? Are you being paid by the government to research a question? And very few people, even here in the United States, are engaged in that kind of research. For example, here in my department, where we have 200 radiologists, less than 10 people are actually doing funded research. But they're doing a lot of scholarly things in terms of like publications and getting engaged and writing things up and being part of other like teams and so forth. So please don't let that discourage you unless you really want to do a research scientist track, which is a very, very specific track. But typically that is anywhere less than 5% of US medical graduates or even like, residency trainees are really in that specific physician scientist track. So think scholarly output. And fortunately, in our countries, we do not have a shortage of interesting cases that could be written up. Our patients are presenting with just incredible pathology, unfortunately, because of the lack of clinical services. So you really could team up easily with a U.S. medical school visiting there, and you guys could write up an interesting case you saw. Boom, that's a publication. Right, so when you think publication, don't think like New England Journal of Medicine, JAMA, Lancet. We don't care. It's nice if you have that, but what we want is a scholarly output that has been peer reviewed and submitted for publication and actually published and so forth. So just wanted to clarify that, because sometimes people, when they say research, they kind of forget what that actually really means, which means scholarly output. All right, not to beat that down. All right, so here somebody says, suppose one is pursuing MMed in OB-GYN final year, looking forward to sit for USMLE and succeed. Do they have to start residency again in program because they finished their MMed?
Yep. So if you are going through a residence system, you are done with your residence training in your country, you'll start
Yeah.
residence as an intern as PGY1. Yes, you start, everything starts from scratch.
They want to transfer their MMed years to your program.
Nope.
Yeah, but I mean, adding to that question, I think there's this new thing in some of the states like Tennessee, Florida, where if you have residents from another country with at least 2 years of experience, you can practice here. It's something that you read every day online, but I don't know anybody who's gone through that way. Yeah, but
Yeah,
maybe in the
I
future.
think you also need quite a bit of like experience out there.
Yeah.
So this means you're, not only have you finished your MMed, let's say you've practiced for like 5, 10 years, then you can come here and practice under supervision. And I think that's what those laws are meant to kind of like, do. But the thing is, there will still be caveats because probably you're going to be practicing under supervision. So somebody else will always need to kind of countersign you, which is probably not ideal, I would say. James, so others, do you guys have other to comment on that? Because this is a common question during these sessions.
I mean, that's what he said. So when you come for residence, of course, through the res route, you're going to start from scratch, and that's what it is. But as Magacha said, because of the scarcity, they're allowing people who have done training. And I talk about this on my talk, whereby you can do, but mostly, I know most of the states, they also see that you have done ECFMG. You are ECFMG certified, which means you can really vouch for your training. And so doing the exam then becomes, it's still an asset. So it's coming. I don't know of anybody who has gone through is doing. I know. I think last 2 years I met two people who were working in New York under supervision like that. And now, but what they do after they get 2 years of experience, they apply for residency and they match because they have been here, they have been working, they have been seeing patients. So they'll still go through the residence because nobody wants to be working and being countersigned for the rest of their life. So it's they always find a route to come to the independent providers. Yeah.
Exactly.
And also to answer that question, before coming here, I'd actually done an internal medicine residency. So back home, I was a physician in internal medicine, although I was only a physician for 3 or 4 months before I marched into neurology.
Yeah.
And to answer the question, yes, you'd have to do residency again. But although I did go into neurology, that said, when you do the residency program in the US, it goes beyond the clinical care or the aspect of medicine, in that there's so much to learn. There's so many aspects of healthcare in the US that we're not exposed to from back home. And obviously, as we come in, there are aspects of care from back home that we introduce to the system. So there are things about disposition, there are things about the social aspect of healthcare. Those are things that you can only learn through the residency program. So even if you come as I came as an internist, even if you come as an obstetrician, you will still need plenty of time to be able to practice here safely, well, and comfortably. And residency, in a way, gives you that.
Awesome. Thank you for that. The question about names came up concerning different names appear on certificates. Do I need a lawyer before registering in my INTILF?
Yeah, so what I said is if your name in your medical school don't match your name in your passport, make sure that if you are still a medical student, change that. If you are graduated, then your certificate is as that. You need to go through process and kind of swear in and say this and this and this and this is now this and this is your formal name. And that's what you will use to kind of do your registration. So I kind of explained in length. Go back and listen to the video that we'll share and you can figure it out.
Awesome. Excellent. I agree with that as well. Somebody says, in the unfortunate event that I don't pass USMLE the first time, what will be the next step? Does that mean I'm done?
So this is the key thing, and that's what I insist on 201. As I said, American medical graduate passed the exam first attempt 98%. Only 2% fails. And what does it mean? There are people who have issues, really issues. So when you fail the exam, you have an attempt, it's a red flag. There are programs which will screen. If anybody has an attempt, they don't even look at your application. They don't even give you a chance. You scored 260 in your second attempt, nobody cares. You have an attempt, you are damaged goods. So the key thing is to follow the process to make sure that you are ready to take the exam and go and give it your best effort, and that's what you get. So there are people who have attempts who have matched, but it's not absolute, but it's detrimental to your pursuit for residence.
I would also say, in the unfortunate event, well, these sessions are meant to remove the issue about unfortunate. Okay, that's the whole point. The whole point of these sessions is to never go into that exam hoping to pass. Okay, and I also tell this to some of my residents here when we do like radiology board exams and so forth. We want to make sure when you go into the exam, even if you're sick, you're going to pass. Like you have to be so well prepared. Like even if you're sick, meaning like you woke up, you have a little cold, you're gonna pass, right? So that means you have a buffer, right? Meaning if the passing score is 214, even if I'm having a bad day, I'm in the 230s, 240s. Okay, so failing means that you're not even able to hit 214. That means you're not prepared. That's not a fortunate thing, and so we really want to. I know it's a bad timbaya, whatever. Something happened. I guess if you feel you're in that situation, I would say maybe reschedule your exam dates. But it should never really be like you went in and you're like, I have no idea. Like, how did I get 210? You would have taken many sort of like preparation tests. to kind of know on average I am scoring in the 230s. On average, I'm scoring in the 240s. And if you're already doing that, because these are standardized tests, it's highly unlikely that you're going to score like, below the passing mark. I just want to emphasize this issue of like luck and fortunate. We said it like, chance favors the prepared, right? So if you're prepared, then whatever the luck you have, you're probably still going to pass. And I agree that failing the exam, especially now that it's pass fail, it's like a very bad marker. Like, I don't even know whether they override it. Is it like SAT where you submit? Can you can you submit a pass after a fail?
Your transcript has all your attempts. You will see them in broad daylight. And the only way it will drop from your transcript is if you wait 7 years for the exam to expire to start again. That will have a new sheet to start with. And that's an eternity.
Yeah.
So
So
don't go there.
yeah.
Don't try. And of course, in 201, we talk a lot. And frankly speaking, after going through this session, you should not fail the exam. It's sad that people will go through the session and then they will go and fail and then they will text me, oh, I've failed. And like, how did you prepare? And they'll tell you like, what did I say? It's like, why didn't you do what I said? And they look at you and I'm like, I mean, you're experimenting on yourself.
Yeah, we can't
So
help
don't
you
do
there.
this. Don't do this. People fail because of strategy. We give you the strategies, you should be able to pass. And it's the only exam that you go, you know that you're going to pass.
Yeah. So we beat that to the ground. But again, really, I want to emphasize that these sessions are meant to prepare you and make you competitive. And if you follow all of our stuff and you still feel you're not competitive, it means you're not ready. And therefore, I would probably reschedule and study some more before you attempt the exam. Just to clarify, if you already have an ECFMG identification number, do I still need to apply separately from my INTILF ID?
So just to answer it, when you go to my INTIF, you will put the email address that you used to get your USMLE number, and they will send you a code you will activate and the account will be joined. Don't start a new number.
Not USMLE, ECFMG.
Yeah.
Yeah.
If already ECFMG identification number is which is USMLE number.
Okay.
It's the same thing, yeah.
So it's the same thing. You just go to my INTIF and kind of put your email. They send you activate your account and things get connected. So you just move on. So if those people who listened to me last year did not apply for USMLE number and they're applying this year, they're gonna pay money while they could have done it for free last year. So it's kind of unfortunate. That's an unfortunate thing, but it's fine.
Okay. All right. It's all right. So for the resources, is there a cheaper option than UWorld?
I mean, I'll let the people who are doing the exam now.
All right. Let's hear the people in the process recently. We haven't heard from Moza. Let's hear Moza.
Can I talk about this a little bit?
Yeah, go ahead, Robbie.
Okay, so UWorld is like very the way they make the question, the way like they teach you a way to think, not a way to memorize stuff. So for many people, like for many of us, this is very like it's very how should I say, it's the basic of understanding how the American education system is. Because like, so let's say, for example, for me, who I graduated from Turkey. So the ethic part is very different. And okay, the disease part, microbiology is going to be the same all the world. Biochemistry is going to be the same. But there's some things like, I don't know, health insurance, ethics, everything is very different how they handle it in the USA. So UWorld is very good at teaching you this because it teaches you how to, to think, like to understand. Yeah, like in order for you to diagnose something, you have to, have like a basic understanding of the situation. So okay, apart from UWorld, some people also use Ambos and they say it's pretty okay. Ambos is a little bit cheaper. It's cheaper than the UWorld. But for me, like if I'm advising someone, okay, I don't think it's a good idea to go with the PDF version, but until you settle, like until you get at least before the examination 3 months or let's say 6 months, if you can afford to buy that UWorld, the online one, you can try to use the PDF version, or when you're still in the beginning, when you're still trying to figure things out. So I advise you this one. Of course, there are so many other platforms. But I think for me, UWorld is just like, I don't know, it's just like the basic. Yeah, there's nothing there's no way I can sit and study comfortably like how I can do with UWorld, because I feel like it's, I don't know, I trust it 100% kind of thing. So this can be also personal. So yeah.
All right, let's awesome. That
Those are the
ringing
things.
endorsement. Robbie, you must be getting a few percentages from UWorld.
Yes, I would actually like to echo what Roby said. UWorld, 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 I feel like is really helpful when you're studying for your USMLEs. However, like try to get UWorld. Ambos is really great because it actually breaks it down, kind of goes question by question, breaks down different parts of the questions on how you should be thinking about it. So it's Ambos would be a good one if you're still in the very beginning and you're just trying to, like get the knowledge and how the thinking process is. But if you're preparing for the exam, specifically UWorld, and then when you're closer to the end, make sure you also do the NBME exams. Those are usually very similar to what the exam is going to look like. So yeah, try to do your UWorld, try to do it timed. I remember when I was trying to do it, Dr. Koala was like, yeah, make sure you're doing it timed, because I would do it in like one question and then review and one question and then review. But in the exam, you don't get that privilege. So you have to make sure not only are you your question taking, you not only is your knowledge there, but your question taking skills, because you'll run out of time. And that's why I feel like trying to do it in the PDF form may not be as a good simulation of what the actual exam looks like. So time and exam taking skills, I feel like that's also very important. Yeah.
Absolutely. Mongare and Magacha.
For me, when I was preparing for the steps, the only resource I used was UWorld. I never used Ambos. But UWorld is, I don't know, you can pass these USMLE exams without using UWorld. I don't know. I don't have that experience, or anybody that I know who's passed USMLE without
I
using
should buy
UWorld.
shares in UWorld.
But yeah, I think
it's a ringing endorsement. I don't think we even had UWorld. We had first aid, man. we had first aid in Quebec, but we had the OG, man. I took it so long ago, I'm even embarrassed to say.
Yeah, first aid in UWorld, those are the things you need. I mean, they're real expensive, yes, but it's worth it. If you spend those 600, 700, it's worth it at the end of the day.
Okay. All right.
Yeah.
Mongare on the UWorld, or are you a different non-UWorld?
UWorld. That's it.
All right. It's 100%. Whoever's trying to do something cheaper than UWorld, the answer is no. Yes, there's cheaper, but you get what you pay for. In the United States, we kind of say that. There's a reason why things are expensive. And unfortunately, the things that are higher quality tend to be more expensive. I don't know what to say about that, but basically that's a capitalism for you.
Yeah.
So basically you get what you pay for. So basically, and you can see there's a ringing endorsement, and really you want to think of this as an investment and not an expense. So your mindset really has to be, you're putting in time, you're investing time. So do not think of it as an expense, something that you just doing out there. You're doing it hoping to get a return on it. And the return here is that you're going to be a better medical student with more opportunities for employment later on. And that's basically, it's an investment in yourself. And so really, you may have to find other ways to find those funding, but really, as a question of a resource, clearly it's a ringing endorsement in there. So we're getting to the top of the hour. There's one question here about GPA, which doesn't really apply to the USMLE. And what I want to do with the top of the hour is just to allow everybody to give 1 or 2 minute just parting remarks, and then we'll hand it over to Dr. Ignas for closing remarks. And so we can finish maximum 5 minutes past the hour, so that way the video can be under 2 hours, and so forth. And lastly, somebody said, what does it mean by electives in the USA? I think that has been mentioned. We have 201 session that's been mentioned, and that's that. So I think we've covered really great ground. So if we could start to just wrap it up. I see Magacha is open. Then we'll go to Moza, Roby, Mohammed, and Mongare, and then we'll bring it back to Ignas. So, Karibu Magacha.
There's Nema as well. Nema Machum also.
Nema Machum is also there. I don't see her as a co. Did you make a co-host? I can see
I'm
them.
calling, make her a co-host, and she can kind of. She's applying now, so.
All right, sounds good. All right, so Magacha, your 1 minute. What's what for people thinking about doing the USMLE? What's your word of advice?
All right, so I know going through the USMLE process for residence application in the US, it's quite expensive. But at the end of the day, it's a process which I think it's worth it from my own experience. You need to prepare. It's a process that you need a lot of time for preparing. The exams are not easy. They're just not exams that anybody can walk in and pass those exams or get a good score. You need to invest your time for preparation. You need to look into resources you're using. There's a lot of resources for USMLE. Some of them, they're just cheaper versions, and there are other things which are available online. Don't spend your time on these kind of useless resources, I would say. Focus on find few resources that you think they're very useful. Don't forget don't forget the first aid for step one and those NBME questions or practice exams. Just focus on few resources and invest your time on those resources, and I'm pretty sure you will do well. The only thing that you need is just to be determined that you are ready for this process. Once you start the process, just go ahead and finish it. I know you may get discouraged at some point during your preparation for these USMLE exams. You may be hearing different things, the visa issues, but don't focus. Don't let those things distract you at all. Just focus on your time for preparation of USMLE, and at the end of the day, you'll do well. You don't really necessarily have to be here but as I said, electives. Don't think that maybe, because when I was preparing for this USMLE, I was like, I hear people talk a lot about electives. I wasn't sure if I would ever come to this country for electives, but at the end of the day, I did my USMLE exams, and here today I am. So just don't get distracted to this process. Just focus on your things, on your resources, and I'm pretty sure at the end of the day, you'll do well.
Awesome.
That's all I
Asante
can
sana
say.
Magacha, asante sana. And I see Moza next. Karibu sana.
Hello. Yes, on my end, I think I would say listen to the instructions or listen to what with what this Zoom meeting today, everything that was said, just follow it 100%. And if you need help, you need resources, kind of like what Dr. Koola said, the next meeting, when you have your ID ready, we'll have the next meeting. But people will follow up with you. So if you're into it and you're very passionate about it, you'll have people who will follow up. I remember when I was going through my own journey, I'll have Dr. Koola always like following up with me and saying, "Where are you now? Have you done this? Have you submitted? Have you ranked?" And then now within that as well, I have Dr. Magacha as well, who's also following, and I'm very inspired by his journey as well. He's a GI fellow. I hope to apply for him on. So I feel like there's the build up in like the mentorship that you get in this, and I hope to continue that forward as well. So you have really great people here. If you are interested, I feel like you will be able to make it.
Awesome. Thank you very much, Moza. And I like that you said, like, listen to what is said here. I would say sometimes you need to hear these things more than once. Okay, we are sharing a lot of information, and some of you may be hearing this for the first time. It may take a lot of. You may have to listen to it 2-3 times to kind of catch some of the things that we're kind of saying, to kind of like really hear it. So they not only listen, but to actually hear it, you may just need to listen to this thing like more than a couple of times and ask when you have questions. It may sound basic, but just ask for clarification and so forth. It's a lot of information, and if it's new, a lot of these things may not even make sense. But as you're going through the process and as you're going back to listen to the video, I think hopefully those things will make a lot more sense, and also make sure that you're not repeating mistakes, if you will, moving forward. Thank you so much, Moza. And over to Mohammed.
Thank you very much. I think, given the fact that we've heard a lot of experiences from different people speaking here, my take would be this. You are seeing different people at different stages of the process. Yeah, and most of you, I assume, are thinking about doing it. Some of you are more advanced than that. I would say just believe in yourself. And there's nothing special about all of us who are here. We just decided that we wanted to do it. And so the mind sees opportunity, the eye sees opportunities if you're looking for them. And so I would tell you that. I would say at every stage, you will find something that will help you. It's not going to be easy. It's not going to be straightforward. When you start doing the step one questions, you will feel like the stupidest person you've ever seen. And that's common for all of us. I remember I was hitting 20% on my step one QBank. And I remember looking at the mirror and saying, "Way, Kumbe, when you see the true exam, you're an idiot. You don't really know anything." And so I want to just remind you that everyone here has undergone that, and it's not unique to you as much as you would love to be unique in that sense. And so I want you to believe in yourselves. It's not going to be for everyone, but if it is for you and you want to do it, then I want you to say that, other people have done it. There's nothing special. You can do it. And you will find help if you look for help, but you have to be the one to decide that you want to do this. Thank you.
Awesome. Thank you, Mohammed. I love that. And this is why, like, really, if I had it my way, I would really make USMLE step one mandatory for all medical students across the world. If I had it my way, honestly, I would just make that. And basically, if you don't pass like step one, you can't go forward. I think that alone would probably improve medical care across the continent, like the fastest way possible. But again, so this is part of the mission, really, for those who are here and those who are listening us, just to invest in yourself. And as you invest in yourself, you are investing on behalf of your patients that you will see and will benefit from your extra knowledge that you've gained. So thank you for that, Mohammed. Karibu Mangare.
Dr. Frank, I agree with you. Even attending back home, everybody should just do step one at some point.
Hey, you want the chiefs to do step one? Come on, man. Professor. You can't have a professor do step one,
they were just to go back to the basics. So thank you everybody for being here. I'll say two things. There's a concept called the rate limiting step in science, and I'm sure in engineering. This is the step that is the slowest, the most demanding. In biology, a very good example is that the cholesterol synthesis, HMG-CoA reductase. In the process of doing residency in the US, it is ECFMG certification. It is doing step one, doing step 2 CK, and getting certified. The moment you have that certification, people will actually reach out to you asking, how can we help you? I have a personal example in that I got my USMLE ID in 2018. And the first time I did step one was in 2024. So all this other time in between, I was reaching out to people, I was emailing them, asking them for help. I didn't have anything tangible. I hadn't done the most important part, which is the rate limiting step. I did my step one 2024, step two 2025. I got certified 2025. I applied 2025. I marched 2025, and now I'm here. So get past the rate limiting step. And finally, for those who read the Bible, there's a proverb that says, God helps those who help themselves. You have to get over this hurdle. And everybody here has told you or has shared the experience with getting over this hurdle. And the moment you have that certification, we will reach out to you. I've already reached out to enough people from back home, from Tanzania, and we've gone over applications together. And on some of them, I'm almost certain that they're going to match. So we will help you with that process once you help yourself.
Awesome. Thank you, Mongare, for that. Thank you for that. Truly, yeah, God favors those who are prepared. So just and I love the whole thing about rate limiting step. I've forgotten the cholesterol pathway, man. I'm reading MRIs. I don't need it. Who was it? Ignas, Neema Machumu. I don't see them on the thing.
Neema, are you there?
I think she's here. She was.
Okay. If not, while she's getting ready, Robbie, and then Neema, and then we'll bring it to a close.
Okay, so okay, by the way Dr. Frank and Dr. Mungari said about student doing USMLE. So this just flashed my mind. I had this mentor of mine who is now in Chicago, like he's doing radiology there. And like I used to go to him while in Turkey asking for him for advice and stuff. And he told me one thing. He said, I think all medical students should take USMLE. So right now, when you say this, it just like verbalize everything he said. And I think he said like the feeling that, or like you preparing and then doing the USMLE, the way it changes you, even if it's just for the fact that you wanna, take that one step ahead, like it's totally something different. Like it changes you. So for me, I realized like the way I'm thinking, or like the doctor that I'm becoming is way better just by, after I started preparing for USMLE, after I took USMLE 1, I just felt like I'm not the same person who I was before I took this exam. Another thing which I would like to say is I think we should really be thankful, like really thankful. Our professors, Dr. Frank, Dr. Koola, we don't pay anything to them, and like they take their time to tell us, explain to us this. Just imagine someone 10 years ago who have no any connection, okay, who doesn't know where to start from. I'm sure there are some people somewhere else who, are like really good students, but they have no any connection. They have no idea where to start from. So these doctors of ours, very special. They sit here, okay. They take their 2 hours, their 3 hours, okay. Even if it's like once in a while, I think like we should really know the importance of this one. And so for me, I'm really thankful for this. So another thing which I also wanted to add on this is like, for those who are almost doing the exam, those who are preparing, even those who just started preparing for the step 1 examination, or who are thinking, you should always have this thing in mind. You should take your exam when you're ready. Yani, I cannot even emphasize, I cannot tell this how, yani, it's just easy. It's better for you to spend some more money, okay, to reschedule the examination than you taking the examination when you're not ready because somebody's pushing you, because you have pressure behind, or because all your friends are gonna take the exam and now you're feeling pressure. We have exams every day, like literally we have exams every day. And as Dr. James said, we have 2 centers in East Africa. We have a center in Botswana. We have a center in Ghana. Guys, just take it when you're ready. This is the good thing about a USMLE examination. They're always available, and they're doing this so that people can take them when you're ready. So don't just rush and then take the exam and then it's gonna destroy your whatever, as Dr. James said, like everything shows there that how many attempts you have done. Just take it when you're ready. You don't need someone to pressure you. You know yourself, okay? So yeah, also again, thank you so much for taking all your time, Dr. Magacha, Dr. Frank, and then Dr. Mongare, Dr. Mona, Dr. James. Thank you so much for everything. I really appreciate even your time, because I know the importance of this. Because for me, if I had had like a push, I would have taken I would have done my USMLE 2, even 3 by now, because I did know about step 3, about USMLE step 1 when 2023, but I did not, but somebody kind of misled me. So I did not really have like, people who could tell me, do this. So I was misled. I'm serious.
Now you're here. Don't worry. now you're here.
I was misled, and somebody told me, oh, it's very hard for foreigners to march. Guys, don't listen to those people. There are really good people here who can tell you the truth. So you just, as Dr. Mungari said, you just do your part, okay? Just focus on the exam. This ban, political stuff, forget about them. You're not gonna change them, and they're not gonna change anything about you. You just focus on your exam. Do your exam, and then, as Dr. Mungari said, the right people will come when you need them. So thank you so much for everything.
Thank you so much, Robbie. I will tell you that my payment is when I wake up somewhere in TZ with a stroke, and somebody actually diagnosed me with a stroke and not UTI. that is my mission. I get in some like shit, disease in TZ, and I don't get some like stupid like diagnosis because people do not have the knowledge. Okay, so that is the payment. That's the only thing I really ask for. Is like, you guys apply the knowledge wherever you are. So you don't have to be in Kentucky. You don't have to be like whatever, Atlanta. You could be in Nairobi, but applying your knowledge and helping patients is the biggest payment you can give And the way karma works, one of you is gonna be my doctor.
and and treat you with
And God
UTI.
forbid I recover, and they're like, damn, man. Man, Mongari, man, you're like my neurologist, and then like you missed this, like whatever, like M1, like I'm like, come on, boss, what's going on, man? Okay, so I say that as a joke, but it's not really a joke because really we have patients. It may not be myself, it could be my parents, it could be my friends, it could be my relatives, and so forth. And all of us are patients in waiting. And so the mission of making sure that we have lots and lots of really, really good doctors is very, very important. And likewise, for all of you who are here, we hope at some point when you become specialists, you will look back and help the MD1s and even like secondary school students who are wanting to become medical students to become doctors and so forth. Like humans will always need doctors. I don't care. Like even with AI, like we will always need physicians. You'll always need people to take care of humans. And so that's what this is all really about. And I really appreciate all of you being here. I don't see Neema Machumu here, so I'll give you the last word, Dr. Ignas, to close us out. If you can see Neema, you can invite her, but Karib San.
Yeah, thank you very much. Thank you for the panelists. It's a pleasure to work with you. Through this process, I've come to know very determined, very intelligent young men and women. And it's my pleasure to come across and meet you all. I enjoy it. Frankly speaking, nothing gives me more pleasure than meeting a driven, knowledgeable physician who is looking to make better for themselves and their patients. So we have shared much information here. Share with your colleagues. Go ahead, get your My Intith ID, share it with us. As I said, 201 is by invitation only. This session, you can be even a border driver and you can join. You don't have a stake in the game. You just come and listen, is your bundle, and you're done. But for 201, 301, it's by invitation only. You are helping yourself. We help you. And real sense, try to apply yourself. Google before you ask. That's my request. There's no problem that you'll have. Nobody has come across it in this world. So Google, do a good search. And even when you present to somebody, you're asking question, you say, I saw option A, B, and C. Which option do you think I should take? You have done your homework, not like, how do I get into it? I mean, I don't know it. I've never been there, So it's apply yourself. Everybody is so busy. We are trying to squeeze in to help you guys. We are trying to reach as many people as possible, and that's the essence, to help the people, get you away from the psychological warfare, like the one which Robbie went through, like, oh, nobody passes those exams, don't do them, like it's a psychological warfare going around. So, it's really important that you apply yourself. And when you succeed, be there to help others. I tell my panelists, I tell all people I help, I'm expecting you to step on the plate to help other people, to guide them. And that's how we're going to build ourselves as a community. So it's very, very important that whatever support you get, you stand up there, you offer your helping hand, and you bring other people aboard so that they go. And actually, my practice, when we talk of 301, the people who are ECFMG certified, I give them my personal cell phone. Get in touch with me. You are here. You have done it. You are my colleague. We are going into this for you to get into your residence and move on. So it's really important. But now with more than 1,000 people registered for this session, if I start answering your messages, that's what I'll do for the whole year. I need to work and get paid. So we can't do that. So as you classify yourself, you separate yourself. We are there to support you, and that's what we'll do. Thank you very much. And please make sure you listen again, and do the needful. And I hope I'll see you somewhere in March to talk about how to study for the exam and make sure you pass.
Thank you very much, Dr. Ignas. Thank you, everybody. And we will close the session now and share it over the social media. Thank you so much.